name is Allie. I'm a dental hygienist here at Enamel Dentistry. In this video today, we're going to review coronal polishing and flossing techniques. So let's get started. So for coronal polishing, I like to hold the prophy paste in my hand and press the prophy angle into the paste while I press the rear step pedal to help fill the prophy angle cup. When polishing the teeth, you want to get all of the coronal surfaces. You also want to make sure you're applying enough pressure to flare the prophy cup into the cervical third underneath the free gingiva to make sure removing the plaque and biofilm underneath the gums. Remember to also flare the prophy cup into the inner proximals of the teeth to help remove the stain and plaque that could be in these areas. One surface that's often forgotten is the occlusals of the posterior teeth. We have to make sure we're polishing these areas as well, since there can be plaque in those grooves. We want to give those chewing surfaces that same love and attention. Let's review flossing. The most effective flossing technique is the C-shape technique. You want to grab a long, generous piece of floss, at least 18 inches, which is about an arm's length. Start by wrapping the floss around your middle fingers and use your index and thumbs to help you guide the floss into the contacts. To get the floss in between the teeth, I use a back and forth sawing motion to break the contact. Once you're in between the teeth, hold the floss against the tooth in that C shape and scrub up and down all the way down to the base of the pocket and back up and down the sides of the teeth 2 to 3 times at least. Then come up and back down into the other side of the gum tissue and repeat that same motion of the C shape and up and down against the teeth again 2 to 3 times to make sure removing all the plaque and biofilm along those tooth surfaces. Once you have flossed both sides of the teeth, saw the floss back up through the contact to get it out. Wrap the used piece of floss around your middle finger and use a new piece of floss in each of the following inner proximals. One of the things that I've realized is that patients appreciate you taking the time to show them what you're doing. During the flossing portion of their cleaning, I always like to hand them a mirror and have them watch me while I do that. Most of them are just popping the floss in and out, so they really appreciate you kind of breaking it down for them. I typically show them, see how far I'm going down into your gum and how I'm on this side. I'm scrubbing up 1, 2, 3 times, and then I'm going back onto the other side. Most of them didn't realize they had to floss 2 sides of the teeth. They thought they just had to pop it in and pop it out. So it's a really impactful moment for them to see how they should be doing it. I hope you guys enjoyed this video. See you next time. Bye.